Welcome to the Congress Agorà 2022. We are with Luciano Lanfranchi, plastic surgeon. Good morning, Dr. Lanfranchi.
Good morning.
Well, let's start with the first question. What are the innovative content, the confirmation that you want to highlight regarding your participation at the Congress?
Well, I would like to highlight everything, because each time I come here to such a big Congress, each time we come here, this Congress gives us the opportunity to grow. We need to keep updated. We need to share our experiences, our techniques. And here is very important because we see the best of technologies, the latest updates on that, and above all, on the products that we use. We can share our experiences. We can learn from each other, which is something amazing, because there are a huge number of sessions and colleagues, which is amazing, because this is what keeps us really alive, I would say, from the professional point of view. So it's very, very important. It's always a big opportunity to be here.
As for your experience, are there any specific recommendations for your colleagues?
Well, first of all, of course, for the youngest one, for sure, it's very important to be prudent, to know their limits, and to keep on studying, learning, exchanging experiences, and being, as I said before, updated. Because this makes us have new ideas, obtain safer results. And if we take into account the fact that safety, of course, is mandatory, but safety means who we are. We need to know our limits. As I said before, it depends on the studies we did, the people we work with, the clinics where we work, the materials we use, and the techniques we apply. So this reduces the risks for the patient, makes us obtain better and above all long-lasting results, which is very, very important. And this means improving our quality. With the passing of the time, we improve, we share, and we grow together.
And you think that the young colleagues, they want to learn, to improve themselves?
Of course. I think the most important things, the learning curve is very important. Each of us knows his or her limits. And this is something that we need to learn. One of the first things they should learn is to say no, because there is not the right indication, or because I cannot do it. I'm not prepared for that yet. So that means I need to keep on training and learning. There's a learning curve. Of course, young colleagues, maybe they are so excited to overdo, but putting their limits, I think, make them grow better and with safer results for sure.
The aesthetic medicine is becoming more safer and ethical. Are there any clinical findings and recommendations for patients?
Well, for patients, it's mandatory to know who are their physicians, their doctors. They need to know who they are, what they've done, what are their trainings, and the materials that they use. They must be top, for sure. We want the best for our patients. But above all, the ones that won't tell or propose extremely unnatural effects, because this is another issue we need to talk about, which are the false concepts of beauty that generally social media could stimulate. So in this case, ethics are mandatory for sure. They need to find the right professional, the right doctor, the right physician to obtain for sure not only natural results, but above all safe procedures.
And authentic beauty.
That's it. That's it.
Let's talk about nose reshaping, from surgical to non-invasive treatments. Tell me more about.
Well, for us plastic surgeons, when we perform rhinoplasties, it's something really complicated. Why? Because we are changing, modifying something, and there are lots of variables that can happen. So we need to be very clear before. We need to select very well the patient. We don't have to let's say, to say things that are impossible to realize. So we need to be very, very precise with the risks and the limits of that. But when we're talking about non-invasive procedures, we can offer a lot to them, for sure. Hyaluronic acid, threads, toxin, etc. So it's a big compound, lots of things, lots of weapons we have that we can use. We choose the right one for each patient, but it is very, very important to be respectful of the tissues, not to create false expectations, and to choose the right patients. Why? Because there are lots of risks. Okay, we can offer, after, for example, someone that underwent a rhinoplasty time ago that has some imperfections, we can treat that little asymmetry, for example. But when we are treating, for example, secondary rhinoplasty, the one that already underwent the rhinoplasty, in that case, the risks increase. Why? Because the anatomy could have changed, so we have to be much more prudent each time we face some of these procedures. But in a way, this is the beautiful thing of this, because we are here. Also, there are dedicated sessions when we talk about the danger zones, what to do, what not to do, and how to behave if something happens. That's why, fortunately or unfortunately, our mobiles are always on, both for surgical and non-surgical procedures.
Okay. Thank you, Dr. Lanfranchi, for your very interesting contribution.
Thank you very, very much. Thank you. Thank you.
Have a nice day.
Thank you. Thank you.